Greetings and thanks for tuning in to this seminar. In this video, Dr. Childers is going to go over a few details such as what stem cells are, how stem cells heal the body, how to get stem cell treatment, Dr. Childers' practice versus other practitioner methods, and finally, cost and payment options should you feel this is the right direction for you. This is Dr. Henry Childers. He's a board-certified general surgeon and cardiothoracic surgeon. He has advanced training in ozone therapy and regenerative medicine operating out of Delaware. If you're watching this video, it's probably because you've got a debilitating disease you've tried to address but was most likely unsuccessful through medications or other procedures such as steroids and have not worked so far, and thus you're here. Dr. Childers' background includes professional yacht racing in the America's Cup aboard the Stars and Stripes. During his college years, he played rough sports including football, lacrosse, and hockey, and his joints took on a lot of wear and tear.
Like most people, I had taken different pain relief. I did not want to do opioid medications. I was using other forms of medication to relieve pain. I've had steroid injections, I've had Synvisc injections, all to no avail. And I understood at the time that was only a Band-Aid and it wasn't going to treat the underlying condition.
Dr. Childers had an evaluation with an orthopedic surgeon who told him his only option was total replacement therapy, and that didn't sit well with him. So he started looking for other avenues of replacement treatment.
So 10 years ago, I started with regenerative therapy, and as a result of that, I've regained full function of all of my joints. I've had my shoulder treated, I've used stem cells, I've had my right hip treated, I've used stem cells, and I've had both knees treated. Before I had my shoulder treated, I could not lift or raise above a horizontal, and now I have full extension. I couldn't do this, and now I have full extension of my right arm, and that's a significant difference.
How has stem cell regenerative treatment changed Dr. Childers' life?
I'm pain-free. When I sleep, I don't have pain. When I reach for my car seatbelt, I don't have pain. I could reach and change light bulbs, and I could not do that before. So from a lifestyle point of view, my life's completely changed.
So what are stem cells, and how do they work?
Stem cells are what we call undifferentiated cells. At the beginning of life, you have a sperm and an egg, and you have one cell, and that divides into two. 9 months later, you have a complex human being with all different tissues and different cells. They all came from the one single cell which divided into two, divided into three. Then they changed into the specific groups. They have several properties. Number one, they're live, so they can divide and make more. Number two, they can differentiate. And injured tissues give off a signal that attracts stem cells. And that attraction, that signal, that biochemical signal that attracts them, also tells them what kind of cell they need to turn into. That's called differentiation. Third thing they do, and maybe the most important, it's called a paracrine effect. They release biochemical compounds, information, messenger RNA, different genetic material, that influence all of the surrounding cells in the area to act more like a repair cell. So we get three things when we talk about stem cells. Division, so they last a long time. Differentiation, so they can change into injured tissue. And that paracrine effect, which has a regional but a long-distance therapeutic effect on other tissues to help the response element.
What conditions do stem cells work on?
Stem cells are the cells that built the body and repair the body. If you have a broken leg, what's kicking it? Stem cells that come to help regenerate. They work on all tissues, and all tissues are basically an origin of stem cells. What do we commonly treat? Well, it's joints. It doesn't matter which joint it is, a knee, a hip, degenerative spine and back, shoulders. It works great for different things like tennis elbow, but why would you incorporate stem cells when it's probably there's an easier way to do it? And we do a full line of regenerative procedures.
Should I have a joint replaced or regenerative therapy?
People have had successful replacements, and there's a time and a place for that. It depends on how much disease do you have, how old you are, there are different variables. But if you talk to the orthopedic surgeon and he is going to replace a joint, typically they tell you to wait as long as you can. And the reason is because they're not permanent. There's also a potential health risk. If you have, for example, dental work and you better take an antibiotic, because if these get infected, the joint has to be removed. And you likely will be on months of antibiotics without a joint. And if it's a hip, you don't have a hip, you're on antibiotics, life is not so good. And so there is downside to replacement, although sometimes replacements work and they're appropriate for some people. If you're going to have regenerative therapy, you don't want to wait until the last moment. You want to do it at the earliest time possible. You want to do it before the disease develops further. You want to do it and avoid the pain and start recovering as soon as you can.
What are typical results of patients choosing stem cell therapy?
Even the people who don't get to where they want to be, we know biologically the way these systems work, you're going to improve. The question is, are you improving as much as you want? I tell everyone it depends on several different things. Everyone is an individual. The outcomes are dependent on the patient, your genetics, the amount of disease, your compliance with medical advice before and after the procedure. And what I tell everybody is you have to have realistic expectations. Just because you have stem cells doesn't mean you're going to be 14. And it doesn't mean that you're going to be a professional athlete when you get done. Right now, it's about 90 to 95% of the people surveyed have reached their expectation.
The majority of people who get regenerative treatment are over 50. Their expectations are that they want to be pain-free, to play golf or tennis, to swim or ride a bike. They're not looking to get on any pro athlete teams, but their expectations are realistically satisfied.
If I'm going to work to get your knee back to normal or as close to normal as we can have it with regenerative therapy, using all the tools we just described, it would be foolish not to incorporate everything else that has degenerated in the meantime. We do a comprehensive thyroid check because thyroid is one of the most important hormones, and if it is not working normally or optimally, then you're not going to benefit as much as you can. Testosterone, we know, builds muscle and bone. If it contributes to bone growth, why wouldn't we want to optimize your testosterone if I'm going to do stem cells on a knee? Growth hormone's the same thing. Why wouldn't I optimize growth hormone to benefit the regenerative process? It's much more than just doing stem cell injection and see you later. You got to make sure you're covering all these bases. Again, it's like a symphony. All the instruments are important. Stem cells may be king, but all of these other instruments are important.
Where do you get stem cells from? Are the stem cells mine? Are the stem cells safe?
There's several places we get stem cells from. Bone marrow, which are yours, adipose tissue, which is fat, and those are yours, and those are autologous. And then there's a source we call allergenic. It means it's someone else's. From the allergenic source, we get what's called cord blood. These are neonatal cord cells. The other source, which I said was autologous, are from you. Adipose tissue has predominantly mesenchymal type stem cells, and mesenchymal type stem cells are from the germ layer, mesoderm, which are responsible for building bone, muscle, cartilage, tendon. That is a better type of stem cell if you're going to be doing any kind of joint or skeletal muscular work. We've learned in the last years, after a mother delivers a baby, the umbilical cord and placenta contain a large amount of stem cells. So at the time of the cesarean section, mom gets the baby and the umbilical cord goes off into a sterile area, and from that, neonatal stem cells can be harvested. That's a very clean source, and they're very good and they're very young, and they have certain potentials that your cells don't have because they're still generating tissue for an infant which has to grow. So the growth factors and the genetic influencing material, messenger RNA and microRNA, are a little bit different. If you're going to have a stem cell procedure, and I always use the knee as an example because it's the most common joint that we deal with, the first treatment day, what we do is we pull some blood and we spin it down and we isolate something called PRP, which is platelet-rich plasma. We combine that with prolozone, which is an unstable oxygen species, and we inject those into the affected knee or whatever joint. I use an ultrasound whenever I do any injection so I can pinpoint where I'm going. I don't like to blindly do it, even if I've done it 10,000 times. So using an ultrasound, we're injecting into that knee these two substances. The reason we do this is because both, independently, will start a regenerative process. Also, both are inherently anti-inflammatory, and the prolozone specifically stimulates cell function, because what I want to do is create the most fertile environment we have without inflammation and lactic acid. So in 2 weeks, when we transplant the stem cells, we're putting them into fertile ground, and ground that's already started a regenerative process. 2 weeks later, you come in, we're going to harvest stem cells. Basically, we sterilize the abdomen. You're laying down. We don't use any sedation or intubate or anything like that because this does not hurt. On each side, on each flank, put a little lidocaine and make about a millimeter nick in each side. We go into the fat and we're loosening up fat. And at the same time, we're infusing a solution called tumescence, which helps to numb, and it also helps to loosen fat. We know that every fat cell has a stem cell associated with it. So we want to get all of this loosened up. We do both sides. It takes about 8 minutes. And then you sit there for 20 minutes or a half an hour. We'll bring you the cell phone and you can just stay there. Why this is working. Then I come back in and I do the opposite. We sonicate very rapidly, but I'm pulling out adipose tissue, which is essentially fat. And that takes about another 8 minutes. So that hour period, we've collected all the cells we need.
Dr. Childers then takes the cells into a sterile area to spin them down, separate them, and measure them for viability. Viability can range, but typically ranges from 90 to 93%, as there will always be some dead cells. Once he has the stem cells separated, Dr. Childers then uses an ultrasound to guide the needle to the optimal injection location. Will stem cell therapy hurt?
You're going to have an IV. You stick a needle in an arm, it feels like you stuck a needle in an arm, but it's not painful. It's like giving blood. When we do the stem cell harvest, it does not hurt. You will not be anesthetized, you will not have any pain medication, and we converse throughout the whole procedure. No one's complained about pain. If it was an issue, we would do something about it, but it's not. And I know that firsthand because I've had it done. So after we finish with that second stage, which was injecting stem cells into that fertile ground that we prepared 2 weeks ago, you go home and you're going to recover for 6 to 8 weeks, roughly. And then you're going to come back and we're going to do the equivalent of the first round, where we're using the prolozone and the PRP. And we do this as a booster. Now, it's important to know that the vast majority, if not basically all places, do what we've always done, which is you come in, we do the stem cell procedure, and you leave. And some very clever people have started to do a different technique, the one I just described. And as soon as I heard that, I realized there's no way this cannot be better, and there's no way the outcomes can't be better. And I've adopted this, and this is how we do every single case. It's a 3-stage procedure. We start the regenerative process and fertilize the joint. Then we add stem cells, and then we do a booster.
Dr. Childers will recommend the best course of treatment for your specific symptoms at your consultation. This is John, a previous patient of Dr. Childers. John recently received stem cell treatment from Dr. Childers and wanted to share a little about his therapy experience.
My name is John. At the procedure time, I was around 60 years old. Did a little research on Dr. Childers, and he seems to have a grasp on everything. I've seen his videos of when he was in Florida. At a seminar, giving a speech, and I was pretty impressed with his credentials and who he's connected with, who's been in this business for a long time. Well, originally I had a problem with my knees, and it was really difficult, in my business construction and just general in sports too. I couldn't do much, and so I originally had come up looking into having my knees done. Couldn't bend over, couldn't lift too many things. I had several cortisone injections done to help alleviate the pain, but I wasn't getting any good results from it over time, and they just continued to deteriorate. I was just having more and more trouble. Even getting up the stairs became a problem. The doctor said eventually I'd have to have knee replacement, and that was a big difference in coming to Dr. Childers, because I really didn't want to go through a dual knee replacement. I really couldn't afford to do it at the time because I would have had to have stopped all my work and everything. And I wanted to take I'd done some research on the stem cell and decided I was going to try that first. It's been about 12 months since my knees were done, and I noticed instant relief. It's been healing over the last year now, and I can do a lot more than I could before. And that worked very well. That totally cleared up all the problems I had. I was extremely happy with that. Well, I'm much more active, and I feel a heck of a lot better, definitely. I don't have any of the problems I had before. I can do a lot more than I could before. Very happy with the results. I'm pretty much pain-free. which you know was the best part about it. You know, it was all the pains from both issues. You know, they really tend to wear you down after a while. You know, and I'm not one for pain medications, so I was definitely happy with that, especially the knee part. The stem cell I'm very impressed with, because it has exceeded. I was questionable, can it do that? But every day they're coming out with more and more interesting stuff about stem cells, and it seems to be working very well. I'm actually happy because my sister was the one that tripped across Dr. Childers, so I owe her a lot for that. And no, I would have done the same thing I've done, that I had done. I think it was worth every bit that I had to put into it. Well, I tell you, one thing I did, I have recommended Dr. Childers to others, and one of them is a neighbor of so to speak, of mine, a person I've done work for years ago, and he's been up here and had his knees done, and he's had excellent results too. So hopefully the insurance companies will pick up on this someday, because I believe it's a lot cheaper to have the stem cell done, and I think you can get back on your feet a lot quicker than it does the surgeries.
How long will it take before I feel better?
That is different for every patient. How long did you wait till you did something? Could you walk? How much pain were you having? Now, I see a lot of data out there that says in 4 to 6 weeks you're going to have relief. That may be. And if you do, it's because of the inflammatory effect more than anything. You did not build new tissue in 4 to 6 weeks. It takes longer. Remember, all biology takes longer. This is like fertilization in a way. And when you put fertilization down, you're not getting your crops tomorrow. It's going to take time to incorporate into the plant and generate all the tissues. And it's the same with this. You may have pain relief, but that's more of the environment that we changed. We know it's about 4 months when we start really seeing anatomic changes. So I always tell people it's going to be several months before you really start feeling an advantage. And one of the most important things about having this done is you have to be prepared and you have to be patient. But if you look at biology. A broken leg, it's going to take 14 weeks or however long. You want to grow a tree, it's going to take long.
How many procedures do I need?
This is a procedure where you do one and you should not have to come back again. The continuation of healing and remodeling, we've shown goes on well over a year. We haven't shown it goes on for 10 years because we haven't been looking that long. But the facts are we don't have people who come back for a second treatment because they're not having problems.
Will treatment last forever?
It was an interesting question, and I didn't know how to answer it. And I use an analogy. It's like if you wear the tread on your car down to nothing and you got a brand new tire, it's good to go. Will it last forever? No, it'll go for 100,000 miles or however long. When you rebuild tissue and you get back to a certain level, you're not bionic. It will degenerate just like all the other tissues in your body degenerate. And if it took 50 years for the first one to lose X amount of tissue, it's going to take 50 years again. You're starting at a new baseline, but you're not bionic.
How much does treatment cost? Is treatment covered by insurance? Is there financing available? Stem cell treatments are not covered by insurance at this time. However, we do offer financing. Insurance will typically cover the cost of lab work. If you have an HSA, you can normally pay for treatment out of that. Regenerative treatment prices are as follows below. Stem cell treatment package option 1 includes the following. We offer 0% financing for 1 year. Take the first step and have a detailed consultation with Dr. Childers. Click the Schedule a Consultation button today and you will receive a 10% discount off the total for attending this online seminar.